I'm Cassidy.
I'm Margarita.
I'm Joe.
I'm Thomas.
Sometimes we automatically view a product for only having one purpose. If I said the word Botox to you, you would most likely think its sole purpose is for cosmetic care. I once viewed Botox only for cosmetic use too, until I experienced the use for it medically and started informing myself on how Botox can affect not just cosmetically, but medically. In the late 1970s, Botox was used for the first time medically to help treat people with cross eyes. Being a health science major and taking anatomy classes, I learned injecting Botox into the muscle can help the movement of the eye. Another positive for this procedure is stated on Squint Clinic's website, and it's presented by John D. Ferris. He stated that Botox can influence the muscles after 24 to 48 hours and maximum effect 2 weeks after the treatment. Botox use for your eyes can be a quick fix and can help the patient long term. The procedure itself only takes 2 minutes, if not shorter. My personal medical experience with Botox was used for my chronic migraines. I at least would have 13 headaches a month, and no under-the-counter medicine would help at all. My doctor prescribed me a higher dosage in the medicine, but even though my headaches went away, I was still developing symptoms of nausea and dizziness, and I thought there was really nothing else that would help me since I was getting the medicine for it until my doctor introduced me to Botox. And after he introduced me to Botox, I've done a bunch of research on it and love to inform people on Botox because it's helped improve my family, work, and social life. A few other conditions Botox can help with is excessive sweating and body odor, chronic muscle pain, drooling and Parkinson's disease, overactive bladder, and even depression. These are just a few conditions I have found researching on a website called Live Science by Agata Blazik. There are a lot of other things Botox can help with, but have not been approved by the FDA, which can take several years to process. But I do believe Botox can help strive away from many unneeded medications and chemicals we are putting into our bodies, which can sometimes harm us more or even start an addiction. Of course, there are side effects with anything you put in your body, but you'd be surprised that Botox only has one ingredient. Dr. Evan Ransom answers a question on a website called Real Self Botox. What is Botox made of? His response, like many other doctors, is a purified protein from the bacterium Clostridium botulinum. The medical form is safe and tightly regulated. One day, if a doctor talks to you about trying Botox for your medical condition, try not to be biased and think it's only for cosmetic use. I hope this speech informed you on the positive effects of Botox as it did for me in my life.